thought about what beauty is? Beauty is biology, and the human desire for beauty is genetically programmed. Beauty is a social currency that rewards the lucky beholder. Beauty is not one size fits all. Hi, I'm Dr. Monica Bonakdar. I'm an aesthetic medicine specialist practicing in Newport Beach, California. I'm the creator of Monbon Clinical Skincare and Amplify Filler Technique. You are listening to Beauty Heroes Podcast, where I chat candidly with trailblazing beauty leaders, examining, questioning, and challenging everything you thought you knew about beauty and the current beauty standards. My goal is to make beauty more inclusive and accessible to all aesthetically oriented men and women. All right, let's do this. Hello, everyone. Today, I'm speaking with Brad Hauser, Vice President of Research and Development for the Body Contouring Division at Allergan. And I'm really excited to talk to Brad about the CoolTone body contouring device, which is brand new as of 2019 and fascinating technology. Welcome, Brad.
Hi, and thank you so much for having me on the podcast.
So you've been in the non-invasive body contouring space for many years. Can you tell me how you got started in this field and what your background is?
As with many things in life, it's not always planned. So when I graduated from Stanford with a human biology degree, I was also an athlete. So I took a few years to actually run track and field post-collegiately. And when I decided to retire, I was going to go back to med school. And as I was looking to get ready for the MCATs, I needed to find a job to help pay the bills. And I joined a small startup. And that happened to be Reliant Technologies, which brought the Fraxel laser to the aesthetic industry.
Wow. I was one of their first customers with Fraxel.
Absolutely. It was a great product. And I was happy to be there for many years before joining ZELTIQ.
And ZELTIQ is the company that brought forward what product?
The CoolSculpting product. Sorry. So for working on the CoolSculpting brand for the last 7 years.
Okay. And CoolTone is part of the CoolSculpting brand now.
Absolutely. So as Allergan, when we looked at the body contouring division, we really wanted to expand to multiple areas of addressing the patient's needs and not just focusing on fat layer reduction, adding treatments for muscle toning and muscle conditioning, as well as looking at technologies that may impact the skin portion of body contouring as well.
So tell me what CoolTone is, Brad.
So CoolTone is an FDA cleared, it's an electromagnetic device that is cleared for strengthening, toning, firming of the muscles of the abdomen, buttocks, and thighs.
That's amazing. So no more gym time necessary?
Not necessarily. It's a good complement to working out in the gym. But yes, it does strengthen and condition and firm the muscles in the abdomen and can help lift and firm the buttocks as well as the thighs. So it's a great complement to people that do exercise, and it's actually can enhance the results that they get in the gym.
How does it work?
So it uses electromagnetic energy, as I mentioned, and the energy penetrates straight through the skin and the fat layers, and it really only targets the muscle layer. It actually induces very strong involuntary contractions. They're much more powerful than we can often achieve in the gym doing crunches, sit-ups, and squats.
That is fascinating. So does it do anything to the skin and the fat layer?
No, so that the skin and the fat are fairly blind to the technology, so it penetrates right through without increasing temperature, causing discomfort in those tissue layers. And when the muscle, since it's conductive, the electromagnetic field creates a current, which then tells your motor neurons or the parts of your muscle that cause a contraction to actually fire.
You mentioned this is good for the abdomen, buttocks, and thighs. What about other body parts? Is CoolTone looking at any other applications?
Absolutely. Just as we have with the CoolSculpting procedure, adding multiple body areas over the years, we will look to expand indications or body areas for this technology. It does work best on large muscle groups, but the arms and calves are of interest for many patients. So we're actively looking at those areas now.
Can you describe to the audience what the treatment entails and what the body feels like after the procedure's done?
It's a simple in-office procedure. It's 30 minutes. You have 2 applicators that are placed in the desired treatment area. These applicators are about the size of a ping pong paddle. They're applied to the body with a soft strap, and the applicators, they deliver pulses of electromagnetic energy that cause these short periods of contractions, which start at low intensity, similar to a warm-up as if you're in the gym, and they gradually increase as those muscles warm up to stronger contractions to really break down the muscle, which then ends up building and strengthening the muscle. These contractions, they feel a little awkward to start, but throughout the treatment, they're actually very well tolerated. And sometimes after the treatment, for the next day or two, patients can be a little sore, but overall, the entire procedure is extremely well tolerated.
So when you say awkward, does it hurt? Or is it just something that you haven't experienced before?
That's what patients will first comment on is, wow, that feels strange. It's not a pain sensation. It's just a strong contraction. And because it's involuntary, your brain isn't sending that signal. The external electromagnetic field is causing it. Your body takes a few pulses to get used to it, but patients have not been reporting pain, just an awkward sensation to start.
And does it really work? Tell me about studies.
Yeah, absolutely. So the device is FDA cleared, and we've conducted many studies and are continuing to advance those clinical studies. So as with any medical procedure, there are always contraindications and side effects that the patient needs to talk to their practitioner about. But overall, as I mentioned, the procedure is extremely well tolerated. The side effects are fairly limited, and the results that we're seeing in clinical studies are very impressive.
So CAT scan and MRI studies showing actual increase in muscle mass. Am I right?
We're looking at MRI, looking at measuring the amount of hypertrophy or growth or muscle mass that's created with this treatment. But just as you can build muscle in the gym, we're seeing good muscle conditioning with this product.
I love those words, hypertrophy and growth of muscle. So my office has been one of the beta testing sites for CoolTone, and I'm noticing even after the initial series of 4 treatments that on the after photos, patients are actually standing up more erect without any direction from us, and their posture is better. Tell me what you have noticed and if the benefits of muscle stimulation go beyond just aesthetics and if there are functional benefits, Brad.
This is actually very interesting. So as we started the device, clearly we were looking for the aesthetic definition of the muscles in the abdomen and buttocks. But what we were finding and hearing back from the patients is that it also enhanced their ability to do normal exercises, their normal activities. They were standing up straighter. They were reporting less discomfort after doing their normal activities. So the strengthening component of the abdominal muscles, which is part of your core, as well as the buttocks as part of the core, seems to be helping these patients with their posture, some of their other discomfort they had while doing other exercises. So there are definitely benefits that we are looking at studying further in the coming months.
So for someone who is not inherently an athletic person, hearing that your core workout can actually get easier from doing a set of CoolTone treatments is very appealing. Do you find a difference between exercisers and non-exercisers with CoolTone results?
Everyone can achieve results, and results will vary patient to patient. But where the level of activity of the patient comes in is often how frequent you have to maintain the result. So the treatment protocol is 4 treatments over 2 weeks. But muscles, if you don't use them, they do atrophy or they do decrease in strength if you've built them and you're not maintaining them. So those that are more active may be able to go a little bit longer between maintenance procedures than those that are inactive. But it will strengthen both patients that are inactive and those that are active.
Wow, that makes sense. Currently, what are you thinking the maintenance protocol is?
So what we've seen in some of our clinical studies as well as our early commercial evaluations is that the period of time is between 2 and 4 months that patients will likely want to come back and have a single follow-on procedure to maintain the muscle conditioning that they achieve with the first 4 30-minute treatments.
And the 4 30-minute treatments, tell me again, how far apart are those?
So normally patients will do those in a 2-week period, so it's 2 to 4 days apart. Based on the patient's scheduling, it can go out further than that. You just wouldn't want to go beyond the point where they start to lose the benefits. But in the typical patient, it'll be 4 treatments in 2 weeks, so every 2 to 4 days.
Okay, so don't stop working out, and everyone, exercisers and non-exercisers, will have a benefit, but the results will differ.
They can differ, yes, as with any medical procedure. But I think what we're hearing, and it was a little bit surprising from our commercial evaluation, patients coming back and talking about their tennis game, their golf game, being able to hold plank longer, all these benefits just help supplement a healthy lifestyle. And anybody looking for body contouring will often and should be health-minded and looking for ways that they can keep their physique with diet and exercise in addition to these types of treatments of CoolSculpting and CoolTone.
So I understand there's a competitor to CoolTone. How are these two devices different? And why do you think CoolTone is the ideal choice for patients and also for providers looking for this type of a device?
Yeah, so there are other products that are out there for muscle building. The main competitor that uses a similar electromagnetic technology is called mSculpt. When we look at the specifications between the two products, Allergan wanted to make sure we have the highest performing product. So we've built it so that it actually achieves 50% more magnetic intensity than the mSculpt, and that's measured where it interacts with the patient. And then in terms of the practitioner, CoolSculpting has been the treatment of choice. Allergan has a portfolio of products that we partner with our practices. And I think that is another reason why CoolTone fits right in that portfolio. It complements CoolSculpting fat layer reduction. You do fat reduction first, followed by muscle building to see the definition. It's a win-win for patients and practices.
No, I totally agree. Being a big Allergan account and also a proponent of CoolSculpting, it is interesting to see that at first, yes, everyone was concerned, can we get fat reduction without surgery? But having a beautiful body and a contoured, well-contoured body goes beyond just the fat layer. And it's great to be able to use devices from the same company to accommodate the patient's ultimate goal. So what is next for the Allergan body contouring division?
We're always exploring exciting new technologies. And primarily we look for non-invasive technologies, ones that patients can come in and go back to their normal lifestyle nearly immediately. I mentioned earlier that we started with fat layer reduction with CoolSculpting. CoolTone now addresses the muscle layer, and the other layer of tissue that's involved is the skin layer. So we're actively looking at programs that can impact the skin and other areas of the body. So we will love to keep you and all of our customers and patients apprised of new technologies that we develop, but we're always exploring how do we get the best outcomes and make them comfortable and affordable for patients.
So everyone wants to know when they come in for their consultation with CoolSculpting or CoolTone if either of these technologies address cellulite. I'm wondering if that's also what you hear in other parts of the country, or is it just the Southern California obsession?
Now, cellulite is one of the largest, still really unmet aesthetic needs in the space. There are technologies that are out there that some of them are a little bit more invasive, but we actively have programs and are looking at new technologies as well as enhancing our existing technologies to help address that indication for patients. Stay tuned for that.
Stay tuned. That's great. One of my wise and more mature colleagues puts it like this: when there are multiple things to address one problem, and you still don't get the results that you want, it's because none of the solutions yet have hit the target.
Yeah, absolutely. And cellulite is a very difficult condition. It's multifactorial, meaning that there's multiple aspects that have to be addressed. But as the clinicians we work with have been able to give us more insights into exactly what we want to do to address each factor of that, we can then build technologies that can bring the benefits to the patients.
I'm glad that we're hearing it from you that you guys are looking into it. So CoolTone became FDA approved when, Brad?
CoolTone got its clearance in late June, and we started marketing the product very soon after.
And your first set of devices are rolling out in October.
Right now, we're on schedule to start shipping devices, and we'll have many devices going out here before the end of the year. So we're very excited about the rollout and launch of this new product.
How has the response been from your physician customers so far?
Overwhelmingly positive. I think we've heard from patients and from our customers that are part of the commercial evaluation that the patient satisfaction is extremely high. They're seeing results as soon as 2 weeks after the first treatment. And I think those results will continue to enhance in the 1 month to 2 month time frame. And as I mentioned on some of the other patient feedback on their daily lifestyle has improved considerably. So we're very excited to continue to optimize this technology and really make it a long-term benefit that patients can get after fat layer reduction.
Yeah, so I try and stay somewhat non-biased when I do interviews, but I have to tell you that we're very excited with the early results that we're seeing. The beta evaluation asks for pictures immediately after the fourth treatment at 30 days and at 60 days. Surprisingly, many of our test subjects show improvements in their after picture immediately after the fourth treatment. So I'm very excited and really want to thank you for coming on my podcast to talk about CoolTone and educate the aesthetically oriented clients out there that are the early adopters and are going to come in and take advantage of this fascinating technology.
Thank you for giving the opportunity and having me on the podcast. Thank you so much.
Hopefully we'll have you back to talk about extensions of the body contouring division.
Absolutely. Look forward to it.
Great. Thanks.